Dr. Prathap Reddy, first of all, let me say that it's a total pleasure, privilege, very happy to meet you.
And now it's very, very happy that I have met you. And what you have done is phenomenal. I'm so happy that we're talking to each other today.
Sir, what I've done is not even 0.0001% of what you've achieved in your life.
It's not the percentage. What you have done is outstanding.
Sir.
What the people in the world is watching you.
Sir.
And that is important. This is where we feel happy.
I've been waiting for this interview. I won't call it an interview. For me, it is like speaking to a person who's a mentor of entrepreneurship in India. I want to tell you something personal before we start. I've been waiting to talk to you for over 10 years. And because when I heard your story, and I heard about how you started Apollo at the age of 50, and how you brought in people from all over the world, and how you brought in talent and Indian doctors, and you gave them hope. You brought them to Chennai, you brought them to all over the country to serve their motherland. You gave an opportunity to people working in America to work in India. And I said that this truly is a vision that is unparalleled. So I want to start by asking you, Dr. Reddy, what is your driving force? I mean, I'm not going to talk only about Apollo. I see you as the father of Indian healthcare industry. What is your driving force?
Driving force is still because I was very happy in the United States. We stayed there for 10 years. My 4 children were there, and we were very happy. One day I got a letter from my father saying, I used to write to him. He loved cars, and I used to write what I'm doing, how the children are growing, and how we're very happy. On my birthday, I got a letter saying, 2 of us are very happy with what you're doing. But if you can do something back home and make people happy, how will that be? So immediately my wife said, we must go back. And my 4 children were below 12.
Yes.
So Preeta was only 11, I think.
Yes.
So none of them objected. Otherwise, then immediately, next day, I prepared myself to sell my practice and close my practice. It took me 1 month, and we left US and came back here.
Yes.
When I came back here, I saw there was nothing here. Fortunately,
yes,
I brought everything that's needed to start a cardiology practice, being
yes,
a cardiologist.
Yes.
I was trained in one of the good institutions in Boston at the Howard,
yes,
Mason Hospital.
Yes.
So I came back, I started practice, but there was nothing that was available except a few government hospitals, and the level of care that was available was not enough. There are only a few people whom, when I see cardiology, if they need surgery, there is no acceptable surgical program in the country. I used to send them abroad. So one of those days I lost a young man, was only 39-year-old. In October 79, he was supposed to have surgery. In November 9th, he died because he came to us and in a collapsed state because he couldn't afford to go to Denton Kuri. I used to send all my patients to Denton Kuri because he was a great friend of mine and a great surgeon. And although he gave some concession, he couldn't still raise the $30,000-$40,000 to go abroad. That's what shocked me. I said, when I was practicing, I think I was as good as what you call the local Americans. And similarly, all the Indians, I went and saw when they landed in the moon, they had a party on the 28th day. Yes. I saw a lot of Indians there. And this is where in everything, as doctors, who are equal to whatever you call the local Americans, or if that is what it is, I said, why can't we do something here? But then when I found out that everything, import duty was 320%, and the banks could lend for hotels, they can send even for a cigarette shop, but they can't lend for the hospitals. So all of these, so then I said, and the local said, it's all in Delhi. And imagine Delhi, I came to Delhi, first time as a visitor. Second time I came saying that I want to see what can I do to bring these changes. So fortunately for me, I met a general secretary in the plane. So he said, tomorrow you come to my guest house. And 4 other MP secretaries were with him. So we all went for Dharma Darshan. So he mentioned, she just passed away, the Prime Minister, Mrs. Indira Gandhi. Then after second day, the third day she asked, what do you want? I said, Madam, there are only 2% of people who get good health care, the powerful and the rich. You fund 1%, 1% can afford. Now, what about all other people? She walked off. On the 4th day, RK said, you want a meter? Come at 11 o'clock to the office. So I went there. She listened to me for about 10-12 minutes and called the secretary, Krishna Rao Sahib. He spent 2.5 hours with me and then said, call the various secretaries. I'm sending him, you see him. And I want a recommendation for, that was on a Monday, on a Friday board meeting, a cabinet meeting. I want a recommendation from you. So I met the secretary, health secretary, finance secretary, and civil supplies. So they all met, and first on the medical equipment, 0 duty, we do free treatment. I said, of course, because India has got people who can't afford. I'm willing to pay, if you give me 0 duty, I'm willing to a percentage of. So we fixed saying 25% free patient, and they won't charge any import duty, 0 import duty. And the finance ministry said, we'll look at how to fund it. Civil supply said, we will give you, the cement, steel, whatever is necessary to build the material. So it was a nice thing that happened. But to get all this, that was that day. So cabinet passed 0% all of this. Then when I went to the finance ministry, 7-8 trips, he went on. Then finally he asked IDBI to do a study. IDBI also gave a very nice study. It's a unique project. We would like to fund it.
Which year was this?
This was in 1981.
81?
End of 80, early 81. So that 1 year I've been running out of this. So for 6 months, Venkataraman was the finance minister. He was very keen to get it funded. Finally, they did a study. After 6 months, they gave a unique thing would like to fund this. And when the note went, he told me, I'll give you a good news, meet me on Friday in Madras. But when it went down, the one, an undersecretary wrote saying, it is not possible, we will be impeached because this is not allowed. Hospitals cannot be funded by the banks. So he was then later on he went to the defense ministry, and Arnab Goswami came. Arnab Goswami already has given me cement and steel for building, hospital building was going on. And then he told the secretary, are you going to show that I am a useless finance minister of India? He said, what sir? This concept is very sweet to the Prime Minister. She would like to see this change happen. And he took me by his hand, went to his room and typed out a letter that 6 banks will fund you 30 crores and you can avail a foreign exchange loan.
Amazing.
That letter, I went back to the finance minister and said, thank you very much.
That was 1981?
81.
When did you launch your first hospital?
83.
In Chennai?
September 19th. September 19th.
So it took you 2 years after that to set it up. Can I ask you a question, Dr. Reddy, to just pause here? You came back in 1969?
Yes, 71.
1970, 71, okay. Why did it take you? You're a man of tremendous energy and clarity of vision. One thing I find from reading a book about you, which is the book I'd recommend to everyone, ladies and gentlemen. It's called The Healer, written by Pranay Gupta on his life. I've been very inspired by this book. Everybody who's an entrepreneur in this country must read it to know how you can mix entrepreneurship with being rooted. But beyond that, my question to you, sir, is, you came back, why did it take you 10 years to decide to start a hospital? Why did you not start it the moment you came back in 70, 71? You were younger, You had your vision. Why? When did you decide? No, I want to have a hospital, and I can't be just a surgeon. So why did it take you 10 years? Do you feel that time period was wasted?
I think what happened was it took me to start practice, and for people to know that I'm a cardiologist. There's a special cardiology private hospital.
Right.
It was a 50-bed small hospital.
In Chennai.
It's in Chennai. So I was doing the practice. I was busy practicing, but as I said, the few people who can afford, I used to send to Dr. Denton Cooley. But others, and finally it happened when I lost that young man in '79 October.
You lost
when
the young
I
man.
lost a 38-year-old who was accepted. Denton Cooley gave him a date in October. And
but he couldn't go.
He couldn't go there, although he gave a concession from $50,000. He said he'll give him 20% discount. So, but he couldn't raise that money. In November 9th, he came to me, almost collapsed. I couldn't do anything to him. That really shocked me and said, how many people are going to die just because they can't afford this money? And why should they? If Indians are par excellence overseas, why can't we? I think I was, as a cardiologist, I was as good as any local doctor.
So you didn't have the machine.
Same for all this.
It's just that you didn't have a particular machine.
I had everything, but there's no surgical background. I'm a cardiologist. I have no cardiothoracic surgeon. There's no acceptable cardiothoracic surgery in India. They used to do, but not with the same results.
Are you saying that for all cardiothoracic surgery of some level of complexity, you had to travel outside India?
Outside India at that time. There were a few hospitals who were doing, general hospitals.
Why was this the case? Our doctors were not trained in it?
Because they were not trained and they did not have the backup. You need a theater specialty, you need a good cath lab, and the theater with the special things. All of this, because I don't think you will know what healthcare status at that time was. It was all government hospitals. So in India, and small private general practitioners.
Yes.
But there was no technology that was happening, was not adopted because of this cost, saying import duty was 320%, and nobody attempted it.
So only the rich,
only the rich
could afford
and the powerful. Powerful is people who got influence with the government.
Yes.
The government paid for them, but the rich people, they didn't mind what it costed. So wherever they want, they could go. Most of the people, president who inaugurated, he went to Houston. Prime Minister Narasimha Rao, he went to Houston. All the Chief Minister Ramarao, all of them I sent to Houston, who could afford, government paid for all of them. But so many rich people I've sent. The other day I had one patient whom I sent. He is now 94-year-old, and he's still looking good. His surgery was done, and he comes for a checkup, and he's absolutely normal. That's why I think he's an example for me.
Well, you're looking very good yourself, I must tell you, sir.
Because
you look fantastic. What do you do, by the way? I mean, just taking a detour from this. You're looking in fine fettle.
Fine, because I think I follow what others I want them to follow. I'm a diabetic. I'm a hypertensive. I have the history of my parents had history of cancer and hypertension, and I had the stress, all four, and I had an attack 15 years ago. I had a chest pain. Immediately I called my doctor. He took me in 15 minutes. I was in the cath lab. He put a stent. I'm perfectly all right. I'm doing my normal job. So I think this is what is necessary. That time it was stress. Although I was looking after my diabetes, hypertension, everything, because of the stress of opening hospitals, the problems of bringing that, the excellence in care for patients, that stress probably brought it on. Now I know how to de-stress myself, The moment I go home, I do my prayers, and I forget everything of the day. You know. So that de-stress is.
I read in your book.
That's my,
I read in your book. Right here, in fact, I made a note of it on page number 4 about your approach to life. And you said there are 3 P's that guide you. And the first P is purity, the second is persistence, and the third is patience.
Patience. I think we
Purity,
need
persistence, and patience. Have you become more patient now compared to how you were earlier?
I think
And
it was necessary.
Can you expand on this a little bit? These 3
Necessary.
P's?
I don't do anything less than before. But whatever I do it with that purpose, because I am in healthcare. My patient is first. So whatever the patient needed, I continue to do that. But I don't take that stress is removed, you know. But the 3 P's. The first, purity.
Purity.
For the patient, you must give him beyond his expectations. You know, there are 4 C's that we do in our hospital. Clinical excellence. Our doctors are par excellence. It's not that they are born with it, but when they come here, they have all the facilities that are required for them. I give them the backup support. And I only ask them, patient has this expectation, you should live beyond this expectation. And same thing, the supporting staff. It's not just my doctors which make up all. My nurses, my technologists, my managers, all of them are become par excellence because their focus is on the patient. This is all that I ask them. And Preetha, my first daughter, she called it saying TLC, tender loving care.
Tender loving care.
Apart giving excellence in clinical excellence, giving them TLC.
Yeah.
So I think this is where Apollo is today is known, not only for doing whatever we are doing anywhere else.
I think you're a living example of preventive health.
Yes.
I want you to tell me that story because you mentioned it somewhere, I heard it, that you've had hypertension, you've had diabetes, and when you started your Apollo hospitals and you called it, I must also hear about the story why you called it hospitals and not hospital, though it was a single hospital at that time. We must talk about it. But tell me about yourself. See, I want to know people to know more about you. Here you are, you're over the age of 50, you've come back, you have 4 children, you've given up, you're giving up a medical practice to become a medical entrepreneur. You come from a wealthy background, but not a super wealthy background that can sponsor a hospital. So you're pretty much doing everything on your own.
Yeah.
You have no great political connections. You try your best. You go to banks, try to get loans. You know, so you're desperately trying to do something there. And on top of it, you had all the lifestyle disorders. Some of them may be inherited, not your fault. So how are you doing okay today? I mean, and you must have gone through the last 40 years of incredible stress
I think
and
when
pressure. So tell me how you first managed your health and how your approach to life and business has changed over the years. But I'd really like to know about your personal story on preventive health.
First, as I said, when I came back to India, I started practice and wanted to give the very best as a cardiologist.
Yep.
And I worked hard.
Yep.
As my practice increased, I worked harder and harder. But on the dot of 8 in the morning, I'm in the clinic and see the patients on my rounds, then see the outpatients on time. After 3 o'clock, after 2 o'clock I go for a short break for lunch. 3 o'clock I come, anybody who is on queue, on lines I'll see. So I've had good practice, so I was doing that, but I was seeing whenever the cardiac, our cardiac care, when it needed surgery, that is where the country lacked. So this is where I think my focus was saying, how can we bring in everything, not in cardiology, how can we bring for our people what others are
So what was lacking?
few
Was it,
people.
was it the machines or the
It
people?
was technology was completely lacking. The people was not trained in that.
How did you
in
get
that
trained
focus.
people into your Chennai hospital?
First,
did
I
you
think
do it on day one,
I
or
d-
did it happen over a period of time?
No. From day one, what I did was, number one, I took 4 or 5 doctors from India who were leaders in their field. Girnath in cardiology, Mani, and like that 5 people I took, and Subramanian for pathology. But more important was, I went to UK and US, brought people who are already trained in that.
How did you do that? Because
Every year I used to in April, end of April, I'd go to UK, stay for 3 weeks, interview probably about 300 doctors, bring about 150 doctors, go to US, probably see about 100 doctors who had intention to come, pick about
this is
30
in
of
the
them.
1980s?
This is 82 I went, brought the first batch of 50 doctors.
Can I just pause you there, sir, for a moment?
Yeah.
In the 1980s, I presume, I was just a child then, I presume that people were working hard to be doctors and going abroad, going to the United Kingdom, to England or to the US would have been a dream for the doctors. Everybody is not a Dr. Prathap Reddy that they want to come back on their parents' instructions. So how did you make them come back?
I think...
were you winning them over with money or opportunity or with something else?
I think what I told them was, this is the type of hospital that we are going to build. We want to give our people the same level of care that's available for them anywhere in the world. And you are a specialist in cardiothoracic surgery, you are a specialist in gastroenterology or gastric surgery. If you have an opportunity, I'll give you everything that you have here, backup technology. But I want your clinical experience. So this is
And people responded to you? People responded to you?
They responded. There are few.
Which is the who is the first doctor working abroad who you brought back? Do you remember?
Ramanathan. Mr. Ramanathan.
Tell me about it. Tell me about the story.
Mr. Ramanathan, he was working in St. Olive's in London. So it's a relatively smaller hospital compared to the big hospitals in London proper. But he was a super doctor as a gastric surgeon. So that's the first person at the same time on that trip, I brought another 15 people who agreed to start. This was before starting the hospital. In 6 months, the hospital will be ready, and we should come back 1 month before, so that, and then to take down what all they needed as a backup for the hospital. So they told me what they needed, the doctors in UK, and I brought 3 doctors from US. One is Prem Singh. He was a brilliant neurosurgeon. So he wanted what all they needed for cardiac surgery.
They all came back to Chennai.
They all came back to Chennai, and then I had the local doctors.
Do you still do
15 of them.
Do you still, or have you still till recently?
Till 4 years ago, till 4 years ago, every year, then an ad will go in the British Medical Journal that Dr. Reddy is coming, and would you like to come back? About 1,000 people have applied.
Really?
And my direct medical service is here. He will go there 1 week before, 2 of them. They'll interview those people and line up 300 people. And same Taj. 150 on a Saturday, 150 on a Sunday. I did this regularly for 25 years.
You meet them?
I meet them, and out of 150, I'll probably take 50, 60 people. On Sunday, I'll take another 40, 50 people, so who will join me in 3 months.
I don't know if you're aware, but
that's how,
this is the
when
greatest
I started
service.
more hospitals.
This is the greatest service that one can do, and I'm amazed at this because it's, we talk about reverse brain drain today. Today is 2025. Yeah. I cannot imagine that someone's doing this 40 years back.
I think,
And I think this
I think they were convinced, but if they come back, that they can give back to the people the same level of care that what they are doing abroad.
So what this means is that the people who you're talking to have a spirit of national service. They have a spirit of giving back to society. But the government had not tapped into it, and you did.
Yeah. First, they must be competent, number one.
Yeah.
You know, everybody that goes abroad are not the same. I wanted super people who could give back and train our people, and then understand that whatever they're starting, it's starting the first time, but they must do the very, very best.
Dr. Reddy, I'll talk about macro issues later, because I think that what has happened is, I think yet your role has not fully been assessed yet, because today, if I was to say who started private healthcare in India, it is you. You started private healthcare, you built it to standards that are global, and many other hospital chains, many other people in this industry are following you, but you're the true leader of all of this. I'll talk about that later. The problem I feel is the gap is so much between public and private healthcare. I would really want your thoughts on what the government should do about this. But before that, you didn't tell me your own story. I told you that you have all the, and I'm trying to take an example from you so that I can also have a fruitful and happy and long life like you. But what would you say to all the people out there who have lifestyle diseases? Because I don't remember, we had a conversation many years back when you said that preventive healthcare is most important. And I didn't even know what that is. Can you expand on it and how you came about creating the first sort of, I think, the preventive health checkup, which everybody does now. You go to hospitals, get executive checkups. There wasn't anything like this 20 years ago.
Anywhere.
So I want you to tell me about both of these things.
See, even when I started my clinic,
Yeah.
I used to see patients with heart problems. But invariably they had, diabetes, hypertension, stress, things like that I used to see.
Those are the basic factors.
In 73,
Right.
I had one good friend of mine, David Grant, who is a pathologist from US. He came to, he is a great friend of mine in Springfield, Missouri. And he came just to spend 1 week with Dr. Reddy. He didn't want to see India or anything. So I was giving him a party that night and called a few doctors before he left.
They must really miss you in the US.
Yeah.
From what I'm gathering,
He's already a friend
really
of
loved
mine.
you in the US.
We loved it, and we were, the two of us, at any given party on Saturday evening. So we were great friends. His wife also was a dear friend of the family. We were great. So both of them came. I was giving a party. Then I said, David, you are a pathologist. I'm seeing all of this. All my patients have some of these problems. Can we do a checkup for it? And he said, there's nothing like that in that. I said, let's sit down and work on it. So we worked on it, and what are the risk factors, what the checkup could be, and called the printer at 12 o'clock and told him and named it as Master Health Checkup. We still
Master Health Checkup.
I still have that board, 1973.
You wrote
Master Health Checkup.
Okay.
That board is there. In the hospital, we put up the board. And a few patients, I used to do 5-10 checkups every day at that time. Gradually it built up. And when we started Apollo, we called it Apollo Health Check. And we did about 20 million checkups. Now, using artificial intelligence, it is a highly, it gives everything about your health. So what I want everyone to have, a preventive health checkup, so that, and we now call it Pro Health. Pro Health Zen, it will do a complete backup of your physical health, but it will also do your what you inherited, because that's the gene.
Yeah.
Then you do genetic screening and gastric biome. With all of these, we know, number one, what problems they have, so we can take care of that problem and then predict their future. On the first part is very important. I'll give you a small example. There are two things that we've done. The place I was born is called Aragonda, in a village near Tirupati, which everybody knows. In that, 5 years ago, we did a complete checkup for the 60,000 people in that area, but only about 35,000 people came for the checkup. They were all afraid to come and have a checkup because we'll find out something wrong. So anyway, 35,000 people, we did that. We have 4 doctors now who go around and treat them, and their health is markedly improved. Now we are doing a re-checkup on them to see what improvements they have done. Number one, in all parameters they have improved in the preliminary report. Only thing is their overweight, weight has gone up. Now they're going to do something about it. But more important than that, I did it for, we are now about close to 85,000 Apollo employees. I call it family, Apollo family members. We did the checkup for Apollo family members and their spouses and their adult children absolutely free. My board said, how many thousands of crores are going to spend? I said, whose money I'm spending? They are caring for them, we should care for them. So, board approved it. Do you know, about nearly close to 50% of them didn't have the checkup for the first 4-5 months.
People working in a hospital chain had not done that.
So we found out, they are afraid that we'll find out some disease.
Tell me one thing, doctor.
You know what we did? What I did for that? When they said they didn't come, I said, don't pay their salary if they don't have the checkup in the next 3 months. They all had that checkup. Now we found out so many cancers, prevented, operated early, they're absolutely normal. And the people had other heart problems, they had stents put in, and they had high blood pressure, diabetes, early cancers, all of them are detected. And of course, these are all called non-communicable diseases. So this is the biggest challenge. Not India, the world has. The world has non-communicable diseases. The world, IMF has declared that, and WHO and UN declared saying, the biggest challenge that the world will face is non-communicable disease. That is the diabetes, hypertension, cancer, infections, now heart stroke, and now we added 2 more, diabetes, overweight and mental disorders.
Mental disorders.
These 7 problems, they said at the end of this decade, 80% of the deaths will be from these non-communicable diseases.
Yes.
And the cost burden for the world is 30 trillion. For India, it's going to be 4.8 trillion. Leave alone the cost. What is it for the family? How is that going to be? Yeah. So we are working very hard on this Pro Health. I call it Pro Health Zen because that gives a complete backup of your personal health, good enough for me for 10 years, but it gives the risk factors. If I remove the risk factors, like what I've done, I had the heart problem. When I'm controlling my diabetes, hypertension, obesity, and all of this, like you are feeling so, you're looking so good. Everybody should follow your example. Yeah? From the time I saw you last, you're looking so good. I think this is what.
I think it makes you feel better. That's true.
You must think, health is also should be their priority.
I think it should be. So.
This is what people don't think.
People don't think and they ignore. Can I ask you more personal questions?
Please, yeah.
Reading about your life story has been a real education. Did your own life experiences, the loss of your parents, in quick succession, determine your approach to health? Because I read that your father was only 62 years old and a very healthy man with great habits, but he died of a stroke at the age of 62, and there could be nothing done for him. Your mother had cancer. And there could be nothing done for her, and she died soon after. You suffered personal losses at that point of time, and in a way, your father was a victim of an NCD, and your mother was a victim of cancer. And therefore, I find somewhere these two approaches in your medical health approach in Apollo, that you are really obsessed about NCDs. Did your father's loss influence you there? You're really keen on cancer. You've worked on cancer. You've built centers over decades of speciality, which are only cancer hospitals, which have never happened in India before. Did the loss of your parents to these two problems influence your approach towards healthcare?
I think that made a tremendous impact on me. When I started Apollo, I didn't start cancer because it was very expensive, the division of cancer. And my mother's thing was always on my mind. So after 7 years of starting main hospital, I said, this is not complete. It's not a multi-specialty hospital if I don't have cancer. And so I started a separate cancer hospital on main on Mount Road, which is like the one of the main centers in Chennai. First private cancer hospital in the country, and all of our hospitals, have the highest standards. We have, like this hospital is the first one to get JCI, Joint Commission of International Law, or JCI accreditation. So every one of my hospitals, all of them are JCI accredited, and then we brought in for the nation's standards. I'm responsible for, in Indian hospitals also, they should get NABH certification.
Yes, yes.
So that hospital only, so this is where I not only followed, others also followed the NABH.
Yes.
And today, Indian healthcare, I always say this, that Indian healthcare, leave alone Apollo 74 hospital, there are another 300 good hospitals. So I'm happy everybody followed it because of that one major step that we took, that funding happened.
So would you say that today
in the
for
last 2 decades.
someone for a cancer patient, earlier we would hear only the rich, privileged film stars and politicians would go to America for cancer treatment. Would you say that the situation is completely different today?
I think people from...
Do you even need to go abroad for cancer?
There's no need to come. People are from abroad are coming to us. For cancer, I've built the proton center, which UK did not have. All of Southeast Asia didn't have. Singapore didn't have. Australia.
Is that the 400 crore machine?
Pardon?
Is that the 400 crore?
1,200 crores.
1,200 crores?
1,200 crores those days. Those days for proton.
When did you bring this in?
About 8 years ago. And then the government took 2 years to give, 3 years to give clearance.
Why?
Because for the new machine, they went on asking questions. They visited 7 hospitals. One day I called the chairman and said, they put one,
for you, they do that?
one proton.
I find it very surprising.
Yeah, because
you're doing service.
With ministries calling them, they were not satisfied. Somehow they visited the hospital. Then when I called them and said, they put a proton next to a Montessori school. That's when they said, can we go and see it? I said, you've already seen 8, go and see the 9th one. So they gave permission for the equipment. And again, they took another 6 months to clear my ground. And it's a vacant place. I said, here I'll build the same standard. That's another 6 months. So after that, COVID came. So hospital could not pick up. So today that's full. 3 machines are full. I'm now putting up one in Hyderabad, one in Delhi.
Yes.
So now Singapore has also started.
Yeah.
And many others will follow this. But here I have a most advanced cancer thing called ZAP.
Yes.
My good friend David Allen, he discovered it, and his discovery, one of the first 10 machines in the, we have it here in an ordinary room for head and neck cancer. It's a simple thing. They come here, go back and.
And what is the impact of these machines on the treatment of the patient?
I think whatever we have done, if a specialist, the specialist must know what is the newer advances that's coming. I bought the first CT scan in the country. There are about 2,000 CT scans in the country today. I bought the first good cath lab, I bought the first MRI, first of, in every equipment, not because of me. My doctors who are in that practice asked. Then there is a thing called RSNA in US, Royal Society of North America. Every November, on the Thanksgiving weekend, they have this exhibition, what's coming up for the newer technology next year. I used to go for 15 years regularly and take somebody who is interested in that, and I had 3 friends of mine locally who will go around. It takes 3 days to go around. So they will give me a report of what is new and the best. And we continuously bought that equipment. And today also, like for example, for Hyderabad and here, I've ordered the Proton. Whatever I ordered that day, on the day of installation, because by the time they install, it's going to take almost 1 year. I must put up the building up to the structure. Then I said I wanted that, they must use that technology. In all my orders with the companies, that is what we insisted. This is why Apollo is known for not only the clinical excellence, but for the technological support. And when artificial intelligence came, we adopted and changed the whole thing. And many things you're going to see all happen. Our hospitals in Gurgaon will be probably the first hospital will be paperless hospital. And all our other hospitals are already changing.
But you also handle people very well. I found a quote very interesting, where a senior physician was asked, "What is the secret ingredient of Dr. Reddy's way with people?" I did not tell him that just days before our conversation, Dr. Reddy himself had said to me that doctors were generally the most difficult people to handle. This was his response to a question, to my question, and there's a quote. "I've always said that the handling of super specialist doctors is like handling ballerinas and divas." Handling one ballerina is tough. Can you imagine dealing with hundreds of doctors who have proved to be that they are the best in their businesses? I think this is an important question. See, there are 2 ingredients of your success. First, 3, your approach to life. You're ahead of your time. You're way ahead of your time. It's not the first medical check, it's the first CT scan, the first MRI. It may seem easy now. At that point of time, it must have been a big leap of faith. Proton, machines costing 1,200 crores. But also,
and JC accreditation.
Yes, and accredited, and using it here, getting people to know how to use it here, and getting it to serve people. But the biggest thing for you is your handling of doctors. And I really wonder how that happens, because can I tell you one thing? Journalists cannot handle journalists. You know, pilots cannot handle pilots. It's often said that if you want to handle a group of specialists, put someone from another field on top of them. Because if you put someone from the same field, he'll be caught in more complexities. You're a doctor, and how do you handle so many doctors? Can you talk more about handling the number of ballerinas, divas, and super specialist doctors working under you and elsewhere? Because you've also inspired them to come from UK and come here. So why I'm trying to talk about this is because handling people is, I think, the biggest skill that is required for entrepreneurs. In today's day and age, Dr. Reddy, anyone wants to start a company, you know, you have startups, they put it on an Excel sheet. Before they've started a company, they want a valuation. Before they've got their valuation, they want their exit. They don't talk about creating legacies. So I would like your approach on handling people and how you manage that.
I think we call it what's called patient first. So I told all the doctors, all of us are here, all the equipment is here, the patient is important. So I think that focus which everybody had. And whenever they deviate a little, I call them to my room, talk them to very softly. What is it that's lacking? And whatever they wanted, whatever is reasonable, we did together. And and today, it is in the first hospital I did, but even then at that time, I had my 4 daughters who worked from that day onwards, and they were, on the spot, seeing things happen, and what could change, what was wrong, what's a toilet is not good, or a patient is, we paid great importance for patients, when they go back, we ask them, give your suggestions. Previously it was complaint, now suggestion. I had an MD who will receive all of these. All those who praised us, it won't go into his computer. All the complaints that they have given, he will show me and tell how it's going to be solved. If it's solved at one place, it went to the other hospitals. So it that problem doesn't arise again.
Process, yeah.
So I think that's what we are following. Even today, a patient, if he suggests, saying, I went there, this was excellent, that won't even reach my ears. But if there was some suggestion that was not good, the toilet was not good,
today.
or the doctor, he didn't give me time properly. Such things will come to me, and I will call the doctor and say, I said, he has come with great hope to you, and you are the specialist, and he won't do it again, because he also knows that together we have built it together, and that power of convincing the doctors to do the very best for the patient, to live up to his expectation and beyond it. I'll give you during COVID time, one of the singers, great singers, I don't want to give her name. So she called me, she insisted to talk to me. She called me and said, Dr. Reddy, your hospital, your doctors are not given me life back. But your people treated me as though I am their daughter. That was more important for me.
Amazing.
That is a care. That is compassion. So as I said, clinical excellence, care, compassion, and cost benefit. That 4 C's we follow. And I think whatever doctor is doing, he knows. If you tell him, I had a great support from my nurse, great support from the technology, and he recognizes it.
But Dr. Reddy, I'm very concerned about one thing, and we all are in this country. You have set up an excellent practice, and you maybe touched the lives of dozens of millions of people over the years.
Yeah.
You've done incredible work. But isn't it a tragedy that in our country, government hospitals and private hospitals are worlds apart? Even today, the doctors in some of the government hospitals are excellent. You go to the All India Institute of Medical Sciences, as you very well know, there's a spirit of service. Some of the best doctors are there in
Yes,
AIIMS
sir.
Delhi. But I'm not talking about AIIMS Delhi or the other AIIMS. I'm talking about government hospitals where people go for their first point of contact, and it is in the districts, and this is a common fact across India. What can be done to close this gap? After all, can there not be some innovative public-private partnership where we can work together to just change the quality of the hospitals and the healthcare provided to?
And that is a very good thing. First, I must accept the government is trying to do their best. There are so many policies which have come, which is a huge deficit, but they are trying to do their best. I'll give us a thing, when you referred saying,
Yes.
how can public and private participate?
Yes.
In my district, Chittor, where I come from,
Yes.
the government we started a medical college, and the Chief Minister, Chandrababu Naidu, was the chief minister at that time. I said, why can't I take the district hospital as my hospital? And that hospital at that time was 300 beds. And outpatient, they used to have about 300 people or 400 people, and about 60, 70 inpatients in 300 bed hospital. Today, it's an 850 bed hospital. An average outpatient is over 2,000 to 3,000 outpatient.
Is it still a government hospital?
It's still a government hospital.
But you are running it.
I'm running it.
Why can't you do the same for many more hospitals across the country?
I think this is same Chandrababu announced a week ago to give at least 10 more district hospitals. And this is where I think good private-public partnership will make a significant impact. For all the see, there are two things solved there. Number one, I have the medical college with a hospital.
Yes.
So I have now made it 850 bed hospital.
Yes.
So I'm training 250 doctors, and now I'll train 300 nurses and all other technology courses.
Can I pause you for a moment?
Yeah.
Will the cost of the service go up for the people who will go to your hospital in Chittoor?
There's no cost to him. He doesn't pay.
So who pays?
He was the government.
People say the quality comes at the cost.
Yes.
So Apollo takes over a government hospital.
Yeah.
Natural feeling would be that the OPD would start costing more, that the medicines would start costing more, the consultation fees would be more. Is that the case?
No, I think for the patient is concerned, he gets all the care that is required.
The patient doesn't pay more.
Because when he comes with a chest pain, we do whatever is necessary that could be done. If it comes as a surgical problem, it's true. That's how the occupancy have gone up from 60 beds to 650 beds occupancy average. During COVID, they did the same thing as what we did in other Apollo hospitals and the best hospital in the world did. Their mortality rate was less than 1%.
No,
during COVID time, because the care they got is the same care that they would get in
any Apollo
hospital.
So, but why can't this be done if this is so much within the reach of government, state governments or central government to do? Why is it not happening? I mean, sir, when we get reports from our media group from several parts of the country, we do hear horrible instances of the condition of government hospitals and the neglect and care. We hear stories about patients who are carrying their family members on their shoulders. There aren't any stretchers, leave alone ambulances. We hear of children lying outside. Sir, recently, 4 years back or so, when after launching Republic, when the outbreak of encephalitis happened in Bihar, or encephalitis, I think if not something else. But we went to a hospital where there had been maximum number of deaths, and we found the conditions to be beyond description in terms of how bad things were. So what is holding us back?
I think the most important is the funding.
The government will pay the marginal difference.
As far as when we manage the Chittoor hospital, now the same chief minister has come back. He has offered 10 more medical colleges, when the district hospitals will be given to them. We look after the district hospital, we look after the Taluk and Mandal hospital.
So then, so would big organizations
I think that
like
transformation should take place.
It should happen.
And when it happens, I think number one, patients will get good care. Number two, the medical college will have good training for the doctors. And all other technology, everybody training.
Whenever I meet people who are visionaries in the field of medicine, I also know Dr. Devi Shetty well.
Yeah.
They all talk about scale. They talk about reaching every Indian. And I think we need to move this very fast. We can't be a Viksit Bharat without a developed country, without proper healthcare facilities for our children.
I think health needs a priority for the government. They are doing with their funds that are available. But I think number one, if the private-public partnership comes, it can make a very significant impact. And as I said, we have demonstrated in one district, and the chief minister now, same chief minister, is now doing it in other states should follow that example. Center should follow that example.
I think so, isn't it? Because I feel that we have so many states and union territories, but during COVID, our toughest of times, it was the direction from the center that pulled our country through.
Yeah. Remarkable work they should do. Remarkable what the government did
what do you
during
feel
COVID.
About the Prime Minister and his approach to healthcare?
I think he's one of a dynamic Prime Minister. I give you two examples. Number one, whatever policies that he has done now, what he's doing on his birthday for the women.
Yes.
It coincides with my women's hospital,
yes.
women's cancer hospital, which I'm starting in Defense Colony.
Yes.
But there are two things I told him. There is a huge, India can become a global healthcare destination. It's not just Sapporo. there are 74 Apollo hospitals. There are another 300 good hospitals in India. We are attracting over from 160 countries. Last month, on a single day, 2 air ambulances came. One from New South Wales, one came from Sweden.
Okay.
2 people
Okay.
who were told that you have no hope in life.
Huh.
So, but the relatives decided they should bring him to Apollo.
Huh.
One patient had pancreatic rupture, abdomen is completely, he was in shock, unconscious. So they brought to the hospital. The boy, I think he's about 19-year-old. He came to my room 5 days ago in a wheelchair. The mother, previously came crying one month ago when she was admitted. You know, I'm going to take, then there's no hope. Now after 1 month, she came, hugged me, and he said, this hospital has given life for my son.
Wow.
And the boy is 90% clear.
Oh,
The other
wow.
person who came from Sweden got discharged, went home. Both were told saying, you have no hope. I said, like that it's happening. It's not just Apollo.
No.
All other hospitals are attracting.
Yes.
So I told the Prime Minister, we should make India the global healthcare destination. Gave 8-9 steps. And then I will give one more suggestion. The WHO said, by end of this decade, there will be a 9 million shortage of doctors, nurses, paramedics.
Yeah.
I said the only country can give it is India.
Yep.
If you can train more doctors, more nurses, more technologies, you can supply. So 2 suggestions I gave him. So he went through, he called us for a day. I said, I want to come with my 4 daughters, 4 C's. So they said yes. My wife said, 4 daughters are coming, can I also come just to see the Prime Minister? So Raji called, she also came. But he talked to me in English because with the Prime Minister, half Hindi, which if I don't understand, it's not correct. So he spoke to me absolutely 100% English because it's policy making. So he said, I went through all your calls, I agree, but I want to change the name as Heal in India because 750 BC, Susruta did the first medical diagnostic, medical treatment. People from all over the world came to India till 1250 AD. So I want to call it Heal in India. The next one, global workforce. I want to call it Heal by India, but we'll follow it. But both things he has said. Number one, after we left, more than an hour, after we left, various ministries started work. Health ministry, my DMS went every day.
Immediately.
Every next 12 days, the health ministry worked. My daughter Sangeeta used to come twice a week to meet the health minister to carry on the first session, Heal by India. And as far as the next global workforce is concerned, phenomenal what they've done. They've opened 40 new medical colleges, and now they're going to put more. But I wish they could do what we suggested, what I'm doing in Chittor, what our CM is doing, giving the district hospitals to them.
I think it's a very worthwhile solution.
Let me finish that. The Prime Minister, he announced this. Now, you heard the budget. In this budget, she announced saying, we're given a provision to add 75,000 additional healthcare people training.
Mm-hmm.
So all of this happening. So I think with the dynamism of our Prime Minister, that Heal by India, Heal by. Only one thing is they have not done is to give visa on arrival. This is what Bangkok did. I did that hospital for them. So what Bangkok did was visa on arrival, so it became a tourist destination. They are now doing in Turkey. They are doing in South Korea. So if India, China also was open. If only they do that, first with the friendly countries, 20, 25 countries, people can come on arrival on health visas if they give. That healthcare destination or Heal in India will become very popular. People, as I said, if from New Zealand and Sweden if they can come, they've already heard about Apollo. They've already heard about India. So they
just want you
so
just
they
need
said
to make it easier for
they
them
get better care they can get here. So I have no doubt that very short time in the next few years you and I will see
Yes.
that a good percentage of Indians, patients in India, hospitals in India, will be treating foreign patients. That's number one is, you are made your country proud, and we are proud that we are treating. People are coming to us instead of our people going abroad, small number. But it will bring them the foreign exchange that is required. Give more employment for people. And the second one, you are giving additional employment for 10 million people by end of this decade. By end of 2040, 37 million is projected.
Yes.
India can do this because we are the only country in the world who have this young population.
Absolutely.
Below 20, below in 20s. Nearly a third of the population is that age. If you can, like what IT did, healthcare can do much more.
True. No, I think we can do it. I mean, I remember during COVID, there were so many hundreds and thousands of Cuban doctors who went around the world, and then Cuba has always had this reputation of great doctors in Cuba, and I'm sure we can do 10 times more. A personal question to you again. Your biggest success besides all of this? Everything your biggest success besides all of this, all the things that we've spoken about, and your achievements are known, and I'm so happy when I hear about stories. I feel that even in our conversation, you're taking particular pride in individual instances of people who have healed, who've come to you, held your hand and said, we got treated here. That gives you your soul happiness.
In my rounds, I talk to them.
Yeah, you talk to them. I know that you take your rounds, and that's amazing. Dr. Reddy, you have a wonderful family. And I think you have the most remarkable wife who has, because I think when I see this, 1969, I read in your book that your father wrote to you. And he wrote to you, and apparently, at that very moment, you turned to your wife, Sucharita. Your father writes, I am so happy, as is your mother, that you and the family are doing well in America. We feel great joy, but keep in mind your duty to your desam and samaj. Just think, if you came back, how many people can benefit from your training abroad? How many people can regain good health? And Dr. Reddy paused after he read his father's words. Then he turned to his wife, Sucharita, and said, well, and she said, without hesitation, we should go home. The daughters were too young to protest.
Preetha was my first daughter.
Yeah, because they've lived so much of their life abroad then, and you were in Worcester, Massachusetts, Boston, Springfield, Missouri. You had become affluent, your daughters liked living abroad. Sucharita was popular because of her cooking and with the children. Everything was said. But you must have an amazing wife to just look at you and say, I don't need any of this, and to support you. Because maybe even if you had hesitation or thoughts in your mind, she made it clear for you.
She made it very clear, and I think I owe a lot for her. Because I was so busy in my practice. My 4 daughters are today super work if they are doing in healthcare. I thank her.
No, but
it is she who
spent. Must be staying in your mind every day. The day you showed your father's letter to her.
Yeah,
it's such a moment.
It's a great moment. I think
50 years back.
That changed the whole thing in my life.
Yeah.
And I'm happy it transformed in India today. When we make Heal in India, Healed by India. And the third one we're doing is Healed by World. My daughter is today, my youngest daughter is there. She is going to sign with one of the major, she has already signed with 2 major groups in US. We do their background work.
Fantastic.
From Hyderabad. In all our hospitals will do their backup work. So that heal the world. So that Heal in India, Healed by India. Now she's going to do what's called the heal the world.
What is the common thing that you've taught all your daughters, you and your wife? Because I find them all very similar in their approach, in the way they approach both business, represent the organization, but they must be different in their own way. What is the foundational learning that you have given to your 4 wonderful daughters? And they are very all strong personalities in their own right. And I've heard that in the Reddy home, women are always very strong personalities. So you have 5 strong women who are probably handling you more than you are handling them. So what is the foundational lesson that you've taught to your daughters?
I think number 1 is my wife's training of them.
Yes.
That you must live a good life, you must give credibility and give something back to people and love each other. And that love each other, I think, made it wonderful. So number one, they've learned to work with each other. Second is they learn to work with people, that is patients and doctors. So today, every one of them is, Preetha is the vice chairman, Sunita, my second daughter, is the MD, Shobana is the vice chairman, and my youngest daughter, she is the JMD. But all of them are doing different things, but they work together. As I said, Preetha now looks after all the hospitals, all the new hospitals, the new projects that are coming up. 7 new hospitals will be built in the next 2-3 years, and a few more will come up. All of this she is looking after. But more importantly, she follows what I did, seeing the patient and talking to the doctors. That is very important. And talking to the other supporting staff. So constantly, especially the new people, every day, I used to, if that 30, 40 new people have been taken, I used to talk to them and say, what is it that we expect of you? What do people who come to us with that thing, what can you give it to them? And that care, compassion. All of this Preetha does. Sunita is the MD. She is managing now the entire thing, all of the 74 hospitals. They're working, their finances, their administration, and all of that. Shobana now, she is my another extreme daughter. She thinks differently. She started first the 24/7, and it came right in time before COVID.
Yes, it was.
And it helped over 24 million people could get call 24/7, get a doctor online, and he will tell your symptoms, suggest, doesn't suggest COVID, or it suggests COVID. I'll send you the diagnostic people. They'll come and take your sample and tell you, and then advise the patient and saying you have COVID, you are COVID positive. What we did was we had 3,000 hospital beds. Out of 8,000 beds at that time, 3,000 beds we reserved for COVID. But more important thing is all hotels were empty. So we took the hotels. So the doctor decided that the patient symptoms doesn't suggest hospitalization. He said, you will go to the hotel, I have a nurse there, I have a home care team there, and our doctor is available on call. So 90% of the people were treated in the hotel and discharged home. And a few of them symptoms doesn't improve, then he is transferred to the hospital. But so I think all this, that 24/7 made a significant impact. And today, the pharmacies, I started a pharmacy at that time because most of the drugs were spurious. I used to import even IV fluids, I used to import when I started practice. So in the pharmacy, I said, we should have a pharmacy which would have genuine drugs. In the last 42 years, I'm happy to say, not one outdated drug or one spurious drug was ever given to any Apollo pharmacy. Today they have over 6,700 pharmacies. That's a big chain. So she is managing all that big chain. But now people get at home, they can call 24/7. The medicine will be delivered to them. And whatever other help that is required, completely. And so now it's become a health tech company. So that's become a big, already one investor has invested a valuation of about $2 billion. I'm not bothered about the money, because money, what do you do with money? We can build more facilities. I want to see how can that be used for more development. So this is what she's doing. 3 years from now, it will multiply at least twice.
Yes.
This is what every one of my 4 daughters are doing. This is why I think my wife made that contribution in training them. That was very important. And today each one of them are a super Prathap.
Well, it's tremendous training. And what about you now? From where you sit, what is the milestone that you have still in your mind? I see in your eyes a glimmer of a person who's still looking forward to doing something next. From my limited interaction of meeting with people, you are a person looking forward to achieving what you do next. I find it amazing. You do your rounds, you meet people. You must have something in your mind, which is your next vision, your next game. I feel you have your next game in you. And what would that be?
I think we should make everyone think health is a priority. And they must know that they should look after their health. For that, as I said, there are two things in the world today. One is health challenges and health opportunities. We talked about the opportunities, that is, here India, Heal by India, all of these opportunities are happening. Health challenges is, number one, bigger problem is non-communicable diseases. And they need not die of non-communicable diseases if they only care for the health as a priority.
Reversible.
I'm trying to bring that thing. So this is where my major step, in doing is to concentrate not only on developing more hospitals, but to give that concept of preventive health.
Yes.
Preventive health is very important. So everyone, what do I need? I want them to spend 3 hours once in 10 years. And then whatever doctor finds out, the risk factors, my man will remind him and to follow that so that they can live happily. Yes. So my future vision is H at H.
What is that?
Health, happiness at home.
You have a similar habit of that of the Prime Minister, with acronyms. Prime Minister also write acronyms, and you like it as well.
Yeah.
I think that you should surely take your ability to build scale and your passion. I really hope that this message goes across a public-private partnership, because I think with all the experience you've had and your daughters are building and growing the business, at a national level, maybe you should work more on creating a public-private partnership mission for the country with the government, and that can be beyond state governments. It can be a whole national mission, and I hope to see you doing it. I cannot tell you how much I've learned from this conversation. I find you a very, very eager and determined individual who has been through a lot in life, and I think you've not built an institution. Truly, I can say this, that without you, there wouldn't be this level of private healthcare in the country. And you're the sole individual reason for that happening, the genesis of that.
Fortunately, throughout, apart from the first Prime Minister and then the next Prime Minister, I had continuously worked with the health department.
Sure.
And all the Prime Ministers. Whatever changed, like for example, I told the health insurance. Health insurance, I opened the first called Family Health Plan. At that time, Prime Minister said he will come and inaugurate in Madras. Unfortunately, he could not come. He sent the health minister. So the first family health plan, the first insurance company, health insurance that has been brought. Then I told you when Chidambaram was finance minister, I spoke to the minister and spoke to Vajpayee, the opposition, to support this health insurance.
Yep.
Who is who in the health insurance in the world came to Maurya for their conference. Unfortunately, that bill could not be passed on that day because there was a Congress meeting in Calcutta. Majority of the MPs have gone there. Chidambaram brought up this MP, and then he went to the Vajpayee ji and told him, I believe you promised that you will support this. I said, I promised to support the resolution, not the government. So they called me at 3 o'clock and everybody was disappointed. But in any case, I'm happy. But the next time, they passed the thing, and health insurance has made a very significant difference. Today, in all of our hospitals, close to 60% of the people are through the insurance. From zero, it's now come to 60%. I wish 100% of them get. So
Yeah.
I want them to first, number one, to have preventive health care.
Yeah.
And number two, not to think of the cost, but to pay a premium for the health insurance,
Yeah.
so you are not bothered
Absolutely.
what the bill is. You get excellence in care.
Absolutely.
And three, of course, is healthcare professionals also must think that they have greater responsibility
I know.
in giving back not only health, happiness to the family.
True.
So that will change. I think in Indians have that habit, and I am very happy that many have followed Apollo, and they're equal or better than Apollo. But we'll continue. That race with each other is good because the quality of care will keep on improving.
Of course.
And what is needed is to adapt to the technology. You know, I talked about Proton. I had a company from San Francisco. They came to me, a company called Lumitron. So they said they're having a new machine which is 100 times more powerful than the present existing AI. So they wanted me to, and 10% of the usage of the machine is for healthcare. That means Proton, I don't have to give 21 days. I can give in 1 day. So all the treatments will work. But they wanted me to buy, for doing a clinical trial, they wanted Apollo to be part of it. But then he wanted me to buy that machine, put that building, which is going to cost me about 3,000 crores. I can buy 3,000 crores, which for to deliver medicine, but not to do clinical trials. We do the largest number of clinical trials in India,
Yeah.
but they pay for it. So I don't pay for the expenses of clinical trial. Here he's asked me to do paper. So I said, thank you. I tried through IIT Kanpur and IIT Madras. They were happy to join, but they were not willing to spend that kind of money for a clinical trial. So otherwise, they'll come back to me.
They'll come back.
They'll come back, and then we are already associated with IIT Madras. We're doing work with them. We are doing with IIT Kanpur, doing some research studies with them. I think we must learn to work with each other.
Yeah.
Ultimately, people must realize that they should prioritize their health. And what am I asking? To spend 3 hours every year to have a checkup. And your health checkup in our Pro Health is good enough for 10 years. And if you are in a risk factor, we'll remove it.
Mitigate.
So the so-called 80% deaths from NCDs can be today, I think 2024 statistics are 60% of the deaths in India are because of NCDs. And it's continuously rising at the rate of 18% cancer. And cancer, as I said, I told you, I lost my mother. I know what it is. But I know, previously we said cancer is a death sentence. Then we said cancer is, can be controlled. Today we say cancer is curable.
Yeah.
I told you, in my village I'm doing that 40,000 people, there's no cancer for them. We found out we detect.
It's all about detection.
We have cleared it.
All detection.
In my Apollo family, complete family, we detected so many cancers and treated. So this is where I think people should think, saying, I want to stay well, I want my family to be happy and healthy. So that's why the 3 H's, health, happiness at home.
Fantastic. Well, I would like to conclude by saying that I'm so happy to meet you. I feel that I'm sure your passion for a public-private partnership with the government will happen.
Yeah.
And I most importantly wish you great health.
Thank you, thank you.
I hope to keep up with you, and I wish you every luck in the world and for changing the face of Indian healthcare. It's been truly an honor to meet you, sir.
And I'm very happy to meet you. Happy to see you healthy and happy.
Thank you, sir.
And I think others should follow that lead.
Thank you, sir. Thank you. Thank you very much, sir.
God bless.
It's an honor to meet you and to speak to you
It's the
today,
same.
sir.
I think let's all work together to make people healthy and happy.
Absolutely, sir.
Thank you.
Thank you, sir.
Thank you,
Thank you,
Arnab.
thank you,
Thank you.
thank you.
Thank you.